Dear friends, I am Dr. Baby Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary, for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the Lasik and Lasek Eye Surgery. Lasik Eye Surgery, laser assisted in situ KERATOMILEUSIS, is a procedure to correct the nearsightedness for farsightedness or astigmatism. This is a surgery reshaping the cornea, the front part of the eye, and is transparent to transmit the light rays to the retina, to be sent to the brain to have a clear look of the object. Procedure. Pre-operative. Advised not to use soft contact lenses for 21 days and hard contact lenses for 6 weeks prior to the surgery. Tests. Corneas are examined with the patchymeter for thickness of cornea. Corneal topography, for surface of the contour of cornea with the aid of a topographic map. Preoperative topical antibiotic drops and oral sedative pills are given. Operation. Flap creation. A soft corneal ring is applied to the eye, holding the eye in place. A flap is created by cutting the corneal epithelium and Bowman's layer with a mechanical microkeratome using a metal blade or femtosecond laser that creates tiny closely arranged bubbles within the cornea, called bladeless surgery to cut the corneal flap. A hinge of cornea is left and folded the cornea back on this hinge. Now stroma is exposed, followed to second stage, maybe one of the two procedures. Laser remodeling. Using an excimer laser to remodel the stroma of cornea, the laser vaporizes the tissue in a finely controlled manner without damaging the adjacent stroma for rapid recovery. Excimer laser uses an eye tracking system. Photorefractive keratectomy, P.R.K. This is the second step of the surgery, and the vision becomes blurry once the flap is lifted, seeing only white light with a central orange laser light. It may cause a mild disorientation. Repositioning of the flap. The Lasik flap is carefully repositioned over the treatment area after checking for the bubbles and the debris and proper positioning. The flap remains in position by natural adhesion until healing is completed. Other types of surgeries. LASEK surgery, Lasik surgery, laser assisted subepithelial keratomileusis. In this LASIK procedure, the surgeon uses some alcohol to the corneal epithelium. This loosens the outermost corneal cells and allows the surgeon to move them out of the way without removing them for the laser procedure. After reshaping the stroma with the excimer laser, the surgeon can The surgeon can replace the sheet of epithelial cells and put a contact lens to let it heal. It is suitable for the patients within cornea. Epi-LASIK surgery, epithelial laser in situ keratomilesis. Here the flap is thinner and made by only epithelial tissue. Once the flap is created, it is moved aside just enough that the surgeon can reach stroma to reshape it with excimer laser. Then the flap is replaced and covered with bandaged contact lenses. It is a hybrid of Lasik and Lasek. The flap includes only epithelium and alcohol is not used here. Post-operative care. Prescribed the antibiotic and anti-inflammatory drugs for a few weeks following the surgery. Advised rest to avoid bright light and rubbing the eyes, and to prevent from dry eyes. Black eye glasses are prescribed. Occasionally, a bandaged contact lens is placed to aid the healing and removed after 4 days. Advantages. LASIK works and corrects the vision up to 96%, and enhancement may still increase the vision more. No pain during procedure due to local anesthesia. Vision is corrected immediately or a day after the procedure. Stitches or dressings are not required in this procedure. Years after the surgery, if age changes bring down the vision, it can be performed again for further correction. Most patients after LASIK get a dramatic reduction in eyeglasses or may not longer needs them. Disadvantages. The correction made for cornea are irreversible. It is a complex procedure. If problem occurs during the procedure of creating the flap, may permanently affect the vision. LASIK can rarely cause loss of best vision. Side effects of LASIK. Glare. The patient may experience the bright lightning. Halos around the images may cause discomfort to the patient. Difficulty in difficulty in driving due to circles around the lighting may become difficult for driving in the night. Fluctuation of vision. Vision sometimes may be clear and sometimes blurred. Dry eyes. It may sometimes cause dry eyes and irritation of eyes. Contraindications. High myopia and thin cornea and other medical conditions. That's all about the LASIK and LASEK eye surgery, and in the next video I'll discuss about some other disease. Thank you.